So المحاضرة هذه ما فيها شيء كثير هي mainly when you read it you will understand what's going on. So I will just go through some points. So what is autonomy? Is the capacity to make an informed and conscious decision. Means that the patient is able to make decision, right? So you have to remember that the patient has the right to decide about the treatment that he or she is taking. Okay? Patient can refuse or accept whatever treatment. You have to remember that. But the patient, you have to make sure that the patient is adult and conscious and knows what he's saying and doing. Right? You can involve some of the family member, especially for the consent, but the patient himself should sign the consent. What is confidentiality? You know that every piece of information told by the patient to the medical staff should be secured and kept in the medical file. Medical file always should stay. طبعا الآن صار most of the hospitals صارت non-paper. All of this information should stay in the hospital. If you have to carry or transfer any information regarding the patient, you have to take out the name of the patient, even for training or teaching purpose. طبعا, all of the patient needs to be treated with full respect and without any discrimination between gender, age, race, color, religion, or whatever. As a doctor, I mean. Always do not harm, okay? Prevent harm is better than to bring benefit. Remember this. هنا very important slide, informed consent. So, as I mentioned, the patient has the right to accept and refuse the treatment as long as there will be no harms to others. This is a very important point. So if there is harm to others, no. For example, if the patient has a contagious infection and you have to keep him isolated to prevent harming the others and the patient refuse, no. You have to force him or call someone to force him because he's making harms to the others. But if there is no harm to other, it's belong to the patient himself. It's the right to take that. You give him the advice, you take another opinion, speak to someone to convince him. But if he refuses, the management, that's his right. So the patient must show sound capacity and judging ability and legal to sign the consent. Otherwise, the consent should be signed by the next family member, first degree family member or relative. Patient safety is another topic, important topic as well. Patient safety in the hospital is very important. The patient expected to have best service by all staff members in all time. So measures and regulation to keep the patient safe are integral part in the practice, not just the treatment. طبعا عشان كذا تشوفون المستشفيات كثيرة اللي يدخل موضوع الكواليتي وما الكواليتي. So في أشياء كثيرة تخص البيشنت سيفتي. including what? Correct patient identification, prevent fall or slippage of the patient, prevent cross-infection or contamination, ensure cleanliness and sanitation of all of the materials around the patient's medical condition assessment as well. There are some regulation and measures during the patient transfers as well. Before OR, site marking should be done by a assigned physician at the day of the surgery to mark the site of the surgery. The belongings of the patients needs to be kept in the safe place in the hospital. Sign in the OR by the surgeon, anesthesia, and nurse to make sure that we are doing the right procedure to the right patient in the right side of the leg or right side in the correct location in the body. Positioning during the surgery by the surgeon, positioning of the patient himself needs to be positioned in a good. Sometimes patient يطلع من السيرجري بإنجري ما لها علاقة بالسيرجري because he was positioned incorrectly. Okay. Time out by the surgeon before the skin incision is very important. Counting the instrument, everything before closing the wound is very important. During the surgery, signing out and patient handover also after finishing the surgery. مو معناته خلاص we have to go to the ICU or wherever the patient is going and explain to the team there what happened and what you are expecting. During transfer, patients connections اللي هي drains or lines also needs to be observed during the transfer because sometimes يكون في withdrawing of the lines or drains, so we harm the patient and injury or complication. Point to remember, the patient has the right to accept or refuse any treatment. The patient is responsible for his decision or her decision as long as he has the mental capacity. Once lost the decision, كويس, so the consent can be taken by his family member. The patient is not free to harm others. هذه أيضا نقطة مهمة جدا. To prevent damage is better than to bring benefit. Do not harm. Proper patient site and site identification for safe and correct procedure is very important. وهذه صارت ترى كثير, مو إنه ما صارت, ما هي كثير, بس صارت إنه البيشنت السيرجن دخل بيسوي عملية, السيرجن عنده 60,000 مريض شافه من قبل, he will not remember everything. So sometimes تصير إنك تفتح, you are doing a procedure in the right leg, so you do it in the left leg, or on the right side of the neck, so we do it in the left side of the neck. So هذه الأشياء ما هي محطوطة عبث. إنه again and again mark the side, make sure, sign in, sign out. Patient is identified by name and specific medical record, or usually both of them, not only one of them, in the hospital. Any question?
الله يعطيك العافية يا دكتور, شكرا لك.
الله يعافيكم. طيب any question about the course غير الكومنت حق الدكتورة؟
إيه بس اليوم قبل المحاضرة الدكتور أنت قلت ما راح يجي شيء في الأوسكي. even محاضرة tools الانسترومنتس حقت السيرجري.
إيه ما راح يجي إن شاء الله.